Medical Monday is brought to you by East Cooper Medical Center.
Well, today I'm back at East Cooper Medical Center and I'm joined by Dr. Parrack. How are you doing today?
Doing very well, thank you.
Now, tell me a little bit about what you do, your background, all that good stuff.
Okay, I'm a gastroenterologist, and my wife and I just relocated here from Wyoming a couple weeks ago, so we're still thawing out a little bit. Been in practice for 7 years. Part of our specialty is dealing with digestive disease, and then it can subspecialize from to pancreatic and biliary disease, which is kind of my area of expertise.
Okay, so where did you do residency, all that good stuff?
Yeah, so I did residency in Chicago, and then went to Las Vegas for my fellowship.
Really?
Yeah, and Las Vegas was not really for me, so on weekends I was going down to Arizona, up in northern Arizona. My folks have a cabin, and I would go down and visit there in a town called Prescott, Arizona, and that's where I ended up working for my first job, for the first 4 years out of training. And good thing I did, because I met my wife there, so everything worked out really well. And then we ended up in Wyoming for the last 3 years.
So you like wide open spaces?
We do, just not the cold anymore.
I see. Well, you'll have plenty to enjoy here in Charleston.
Yeah, we're enjoying it already.
Well, we're happy to have you here, but I want you to tell me a little bit about why you went into your field in the first place.
So I was a scrub tech, or a surgical technician in undergrad, and thought I was going to go into general surgery. And we covered some of the endoscopy cases, and I found that the gastroenterologists seemed to be happier with their jobs. And the more time I spent with them, that held true. And when I got into medical school and started doing some rotations in gastroenterology, it was a very easy choice for me. It was a perfect fit. There's kind of an instant gratification within our field where somebody comes in with digestive distress, and you help them out, and I don't think anybody feels better than they do when their digestive distress has resolved. So there's a lot of different aspects of what I do, but I think all of it can be summarized by kind of that instant gratification effect that I can get for most patients, and so it's a good feeling. Okay,
I gotcha. I know you kind of said it a little bit before, but what is the favorite part of your job?
I love pancreatic and biliary disease. I subspecialized into procedures called ERCPs, and it's a procedure that goes up into the bile ducts and the pancreatic ducts through the scope, and so it's a very specialized field. I really like that type of disease because it can be subtle with the symptoms. It can be something that has been kind of low brewing underlying for a long time that somebody didn't even know that they had, and they feel much better once you find it and fix it. And so it's a very technical type procedure, and I really enjoy doing them. So that's kind of my niche.
What are some of the signs that a patient might need to come and see you?
Symptoms, definitely pain, nausea, heartburn, changes to their bowel habits, or God forbid blood in their stools, and even some subtle symptoms that can indicate pancreatic or liver disease, such as the skin turning yellow or jaundice, or some subtle itching. Those would be reasons to ask your primary care if a referral to gastroenterology would be appropriate. But the biggest area of our practice is screening colonoscopies, and that was recently changed from 50 years old down to 45 years old without any family history or other complicating factors. And so anyone who reaches the age of 45 years old should have their first screening colonoscopy. It took a couple of years for insurances to come on board, but everyone has now. And so if you come in seeking a screening colonoscopy at 45 years old, and we find a polyp or we remove a polyp, that is something that has prolonged your lifespan, and should, if you stay in our protocol, should prevent you from ever developing a colon cancer.
Wonderful. Okay, so where can people go to learn more information and make an appointment with you?
I joined Low Country Gastroenterology here in town, and so they can either Google their website, or they can look us up through East Cooper Medical Center's website. And there's also a phone number that's going to be attached, and they can search for my name through East Cooper's site as well.